Greetings, endoscopy enthusiasts. Welcome back to another riveting episode of the Gastroenterology and Endoscopy podcast. Today we're delving deep into one of the most polarizing topics in modern gastrointestinal medicine, the great cold snare polypectomy versus hot snare polypectomy debate. For those new to the conversation, let me set the stage. Polypectomy, the intricate art of removing precancerous growths called polyps from the colon, stands as a critical line of defense against colorectal cancer. And the techniques we choose to wield during these procedures can quite literally mean the difference between life and death for our patients. In this corner, we have the cold snare polypectomy, or CSP for short. This minimally invasive approach avoids the use of electrocautery, instead relying on a slick guillotine-like motion to sever polyps with surgical precision. Its proponents laud CSP for its exceptional safety profile, particularly when it comes to those pesky diminutive polyps measuring 5 mm or less in diameter. The European Society of Gastrointestinal Endoscopy, or ESGE, has firmly planted its flag in the CSP camp for these tiny lesions, citing its impressive complete resection rates and reduced risk of complications. But the support doesn't stop there. The ESGE also gives a resounding thumbs up for CSP's use on those slightly larger sessile polyps, ranging from 6 to 9 mm in size. But don't count out the hot snare polypectomy, or HSP, just yet. This electrifying technique harnesses the power of cautery, simultaneously cutting and coagulating tissue with its sizzling snare. And when immediate bleeding control is of the essence, such as with those formidable 10 to 20 mm polyps, HSP's coagulative capabilities can be a literal lifesaver. However, with great power comes great responsibility, and we must remain ever vigilant of the unique risks that accompany HSP's use. Delayed bleeding and the potential for deeper tissue injury loom as ever-present specters, reminding us to wield this technique with the utmost care and precision. Now, as endoscopists, we find ourselves at the crux of this debate, weighing the intricate balance between efficacy and safety. Numerous studies have demonstrated that, for polyps in that sweet spot between 4 and 10 mm, CSP and HSP share a near equal footing when it comes to complete resection rates, a true testament to the skill and expertise of our craft. Yet, it's in the nuances of complication management where HSP shows its mettle. That electrocautery edge, when appropriately applied, can help mitigate certain complications, particularly those pesky post-polypectomy bleeding events that can leave us scrambling. But let's not forget the critical importance of polyp retrieval and the subsequent histopathological analysis that follows. After all, our work doesn't end with the polypectomy itself. We must ensure that the excised tissue undergoes rigorous examination, unlocking the secrets that will guide our patients' future care. Fortunately, both CSP and HSP have demonstrated their prowess in delivering high-quality tissue samples, preserving the integrity of the polyp for detailed scrutiny under the microscope. A reassuring fact that allows us to focus our efforts on mastering the polypectomy techniques themselves. As we gaze into the future, the horizon shimmers with the promise of technological advancements in endoscopic equipment. Innovations that could refine our polyp removal techniques, enhancing precision and further minimizing complications. A tantalizing prospect, to be sure. But we mustn't rest on our laurels, for the field of clinical research marches ever onward, shedding new light on the intricate dance between cold and hot snare polypectomy. Each study, each trial, brings us closer to a deeper understanding of when to wield these powerful techniques and how to optimize their use for the betterment of our patients. In the midst of this ongoing evolution, our steadfast adherence to clinical guidelines remains our lodestar, guiding us through the complexities of colonic lesion management. The voices of experts echoing through these protocols serve as a constant reminder of the hard-won wisdom that has brought us to this point. So, let us embrace the nuances of this debate, for it is in the spaces between the extremes that true mastery lies. The choice between CSP and HSP is not a binary one, but rather a tapestry woven from the unique needs of each patient, the characteristics of their polyps, and our own clinical acumen. It is a journey of constant learning, of pushing boundaries, and of never losing sight of our ultimate goal, to provide the safest, most effective care possible in our unrelenting fight against the specter of colorectal cancer. Join me next time as we explore another captivating topic in the ever-evolving world of gastrointestinal medicine.